Many parents are confused after the CDC slimmed down the childhood immunization schedule.
And WLKY's Megan Matthews is getting the facts on how this could change what shots your children get and if insurance will still cover them. Megan?
Hi, Jennifer and Rick. That's right. Only 11 vaccines are now left on the recommended vaccination list, leaving parents and pediatricians concerned. Now, I talked with one doctor at Norton Children's to find out what you need to know about these new updates. On Monday, federal health leaders cut the number of vaccines now recommended for children, with the Trump administration saying they are aligning to the international vaccine schedule, and that change is effective immediately.
You'll see different recommendations all over the world, and that is usually based on what the risk factors are in those individual places. And maybe that is because one disease exists in one country, whereas it doesn't exist somewhere else.
Dr. Heather Felton, a pediatric doctor at Norton Children's, says some of those changes are concerning, with vaccines like hepatitis A and B, RSV, and some forms of meningitis no longer on the list.
I think that there is some room for the shared decision making where you come in and you talk to your pediatrician about what your options are and what is recommended and the science behind those recommendations.
Felton says this change does not affect families who still choose to get vaccines not recommended by the CDC. And for now, those vaccines will continue to be covered by insurance, but that could change.
It's something that we might see if these same policies hold up. However, the American Academy of Pediatrics is still recommending these vaccines. And so for right now, I don't see any changes to that happening as of yet.
As for school-mandated vaccines, states still have the authority to require certain vaccines for students to enroll. This includes vaccines like hepatitis B and A for Kentucky. But Felton says waiting until children are school age to get those vaccines can bring risk factors.
Delaying vaccines does put children at risk because the way that the schedule has been set up is to protect children from diseases when they are most at risk for those specific diseases.
And an increase in illnesses that could have otherwise been prevented.
Right now, we're also seeing record high number of influenza cases. And so, and same thing with MMR, we're seeing more measles cases in the United States than we have in the last quarter century.
Norton Children's is still following the American Academy of Pediatrics recommendations and vaccine schedule. We will have more information on our website, WLKY.com, and on our free mobile app. In studio, Megan Matthews, WLKY.